Hello viewers. Now let's see what are the signs of vitamin B12 deficiency. Vitamin B12 is a water-soluble vitamin. It is also known as cobalamin. It plays a vital role in the production of the red blood cells and DNA and supports proper functioning of the nervous system. The body does not produce vitamin B12, which is why it is important to take a diet rich in it. Deficiency of vitamin B12 arises if the food you eat is lacking in it or if the body is not able to absorb this vitamin from the diet. Elderly, the people those undergone bowel surgeries, diabetic, those taking a strict vegan diet or those taking the iodine drug are at the highest risk of suffering from vitamin B12 deficiency. So signs and symptoms of vitamin B12 deficiency can take years to show up, which make the diagnosis complex. It is often sometimes mistakes for folate deficiency. The signs of vitamin B12 deficiency are pale skin. Those with vitamin B12 deficiency have a pale and jaundiced skin look. There is a yellow tinge in the white of the eyes as well. This occurs as the red cell production of the blood is affected due to the deficiency. The deficiency also affects the red blood cells division, leading to the large blood cells which are unable to pass out the bone marrow, which decreases the number of red blood cells in the body, giving in the pale appearance. Second is weakness and fatigue. Metabolistic anemia due to deficiency vitamin B12 may lead to person feeling fatigue. This occurs due to the lack of red blood cells to carry enough oxygen all over the body, causing a weak and tired feeling. Next is tingling in hand and feet. Nerve damage is a serious side effect of vitamin B12 deficiency. It occurs over time and causes a sensation of pains and needles in hand and feet. It happens because vitamin B12 plays a circular role in the development of the myelin health, which insulates the nerves. Without enough vitamin B12, the myelin is produced differently, which damages the nerve cells and also affects the functioning of the nervous system. Difficulty in walking. Due to damage of the nervous system because of vitamin B12 deficiency, over a time trouble is walking develops. Numbness and tingling make it hard for the person to walk properly or without support. The symptom can also be seen in younger people who have a severe deficiency which has not been treated. Next is mouth ulcers and glossitis. Some people with vitamin B12 deficiency might experience mouth ulcers which can give a sensation of burning and itching in the mouth. Also swollen and inflamed tongue and the log straight lesion can be an early sign of vitamin B12 deficiency. The condition is known as glossitis. Disturbed vision. Blur and disturbed vision is another sign of B12 deficiency. It occurs if deficiency is untreated for a long time, which leads to nerve system damage, damaging the optic nerve that leads to the eye. Next is mood changes. Vitamin B12 deficiency has been related to mood and brain disorders such as dementia and depression. Breathlessness and dizziness. As vitamin B12 deficiency causes anemia, there may be shortness of breath and dizziness experienced by the person. It occurs due to the lack of oxygen supply to the body cells. Vitamin B12 deficiency is a very common condition which is difficult to identify. However, it can be prevented by taking a sufficient amount of B12 in the diet.